Hi, John.
Hello, Andy.
Thanks for agreeing to do this interview with me. I've got a few questions, but can I ask you to introduce yourself first?
Sure, my name is Jon Neal and I am Chief Executive of Suffolk Mind, a mental health charity here in Suffolk.
Brilliant, thank you. Question one, which I ask everyone, is this. So how are you looking after yourself and how are you supporting your teams?
Yeah, well, I'll start with my teams. First of all, we run during normal times a lot of workplace wellbeing training, which is all based around our emotional needs and resources model, and it's based upon the principle of looking after yourself and looking after the people around you. And since lockdown, we've been trying to encourage people to continue using that model, particularly to look after themselves in terms of our staff and volunteers. So we've made a piece of online training available to them that we developed called Meeting Emotional Needs in Practice, which is basically an hour and a half where a group comes together and they talk about what's going on and they talk about it in the context of their emotional needs. So we've made those available to staff. The other important thing I think during this time is as leaders of organisations is communication, because people will have been and they continue to be a bit hesitant about the future. They're not sure what's going to happen next. So the more organisations can communicate and the more clearly and consistently they can communicate, the better, to help people to meet emotional needs for security and control, for example, which are all about trying to predict the future and see what's on the horizon. In terms of myself, I've been trying to get a bit of exercise occasionally, trying to spend time with my kids, which is not difficult at all at the moment when we're all locked in together, of course. So I'm actually trying to get time away from my kids as well. I'm in a house where there are 5 people, and again, coming back to that emotional needs and resources model, it can be difficult to get your need for privacy met, which is downtime, me time just away from all the distractions of modern life. And if you don't get that particular need met right now, especially in the summer where the evenings are longer as well, it can start to impact on your sleep, because if you're not giving your brain time to process what's been going on during the day and you go to bed having not processed all of that emotional arousal, it can then start to impact on your sleep and the quality of your sleep. And the second thing that I've been doing, I noticed that so during normal time, I'd be making presentations once or twice a week around that emotional needs and resources model. And I used to quite enjoy doing them, even though I didn't necessarily always look forward to them. But when I did them, it was half an hour, 45 minutes of telling stories, making people laugh a little bit, talking about mental health through the emotional needs and resources model, but not in a boring or a dull way or a too serious a way, still fairly serious, but in a relatively light-hearted way. And I used to get a bit of a buzz out of that, which is another way of saying I used to get my need for achievement met. And obviously I wasn't able to do that at all during lockdown. So I've been trying to make sure that I get my need for achievement met in other ways, whether that's baking sourdough bread or cooking more or getting more skilled at doing keepy uppies with my daughter playing football, or whatever it might be. So really for me and my staff, it's about being aware of the emotional needs that we all have and trying to make sure that we're getting them met.
Thank you. I mean, the quality of sleep I'd completely recognise, really, really important. And I haven't stopped promoting your training or the surveys that you conduct all the time, because they're critical, not just amongst the public sector, but also the private sector as well. So thank you about that. My second question is this. So what has been the impact of the coronavirus on mental health in Suffolk?
Well, we conduct an emotional needs audit across the population of Suffolk pretty much all the time. We're not gathering tons of data all the time, but when lockdown happened, I instructed the team to start collecting more data, getting more people to fill in the survey through online advertising or whatever it might be, so that we could compare how well or otherwise people were meeting their emotional needs during the coronavirus crisis and compare that to before the coronavirus crisis. And in total, we've got about 7,500 pieces of data. So it's quite a good sample size to compare how well or otherwise we're doing. And some of the biggest drops there have been interesting, and they might be fairly obvious, but some of them are a little bit counterintuitive as well. But either way, they are examples of people's well-being potentially being compromised. Sleep, again, actually is one of the big ones. There's nearly 2/3 of people say they're not getting a decent quality night's sleep, which is actually very worrying from a mental health point of view. It's one of the first things to go when somebody is suffering from mental ill health. It's also one of the most straightforward things to try and fix in many ways. Not easy to fix, but it's straightforward to fix. It's fairly obvious things like cutting down on caffeine, but also getting maybe an eye mask. We've all got face masks at the moment, most of us, but maybe try making an eye mask as well to cut out the light that wakes you up in the morning or to help you to get to sleep in the evening. And other bits and pieces like just sleeping in bed, not doing anything else in bed, not reading or playing, certainly not playing on your mobile phone, leaving your mobile phone downstairs, reducing screen time in the hour running up to sleep. If you've got difficulty sleeping, those are some good tips. But other emotional needs are being hit as well. So community, again, might feel like an obvious one, but actually it's young people that are feeling that they're not getting their need for community met even more than older people, which you might think is a surprise because young people are on their phones and they're online. They've got online communities through their PlayStation or whatever it might be. But actually they are actually missing physical contact with their friends. They're missing their friendship groups. They're worried that their friendship groups might be talking to each other and not talking to them. They're worried about what's going to happen when they go back to school. So there's all sorts of different ways that people's emotional needs are being hit during lockdown or being affected during lockdown. The important thing is trying to measure some of that, being aware of some of that. And then the next stage is trying to fill some of the gaps or break down some of the barriers to getting those needs met.
Well, it's and having seen your reports and the data behind it really tells me that the more self-aware we are, both as employers, as leaders, but also as individuals, the more we can do to help ourselves. Definitely.
Absolutely.
So question 3 is this. So how have you seen the health and care system working differently, and what should we try to keep?
Yeah, well, some of the good stuff that I've seen working differently is the agility, I think, and the speed with which the system has been able to adapt and try some new things. So, for example, when lockdown happened, I got a call from one of the directors at Norfolk and Suffolk Foundation Trust, our local mental health trust, about looking at how we could at Suffolk Mind perhaps take some demand from them in order to increase capacity in the mental health trust. And we came up with a way quite quickly of doing that. We went to the clinical commissioning groups and asked whether they fancied funding it with some of the COVID-19 response money. They acted quite quickly in saying yes as well. And we just basically got on with it. We started something up and tried it, and it's worked very effectively. It's called Suffolk Mind Connect. So it's a brand new service that we've got up and running in the last few weeks. And that, I think, that agility and I suppose trust and confidence in other providers to provide a service to the people of Suffolk, particularly within the voluntary sector, I think is definitely something that we need to keep. And having being willing to explore new ways of doing things and try new different ways of working and ways of delivering services. I think that's something that I'd like to see us continue doing, rather than spending lots of time talking about it and putting things on flip charts and post-it notes and working through different options. Maybe just give a few things a try, especially if they're based on something that's already been tried anyway, and see how we get on, see what the people that use the service think of it, and if they like it, then keeping it going.
Now, we've had some good responses to that service from patients who've been in touch with us at Health Watch. I think the fact that you have a good reputation has helped. And I also think that examples of where the voluntary community sector have been engaged so quickly during this pandemic needs to be collated because that is the future, should certainly be the future. It's good to hear. The last question is this. So, and you may have covered a little bit in the question 3, and it's this: is what learning do you think will come from this outbreak?
Well, I hope that some of the learning is that the voluntary sector is here and is quick and agile and innovative and creative and can respond to different needs and is willing to try different things and is also good value for money as well. I think that's a key learning that for me has come out of this, although I kind of already knew it, but I'm hoping it's a learning that's come out of it from the system as a whole. I think there'll also be a bit of a challenge around the corner as well. The economic impact of coronavirus is being felt now, but I think it's going to be with us for quite a long time. And that potentially has an impact on fundraising for charities, on commercial activity, you know, whether it's through charity shops or like Suffolk Mind does through selling training, but also there could be an impact on the public sector at some point in the future further down the line in terms of funding. So really that's a challenge that could probably be met by some of that learning in terms of the value for money that I think the voluntary sector can provide in delivering services. So hopefully what we've all learned is that we can trust each other and that we should try different things, and that we can learn from each other going forward as well, and that we are ultimately delivering better services overall when we're actually working together and trying to do things working from the same team.
Fantastic. Thank you, Jon. Thanks very much for your thoughts.
Thank you, Andy.